It's Health Tuesday, and today we're talking about eye examination from cradle to the grave. Well, that's from birth to old age. And we have my favorite eye doctor, Dr. Ekene Sharon Enumeh. Now, she's a well-grounded and experienced optometrist with nearly two decades of expertise in clinical eye care. It's great to have you. You're welcome.
Good to see you again.
Okay.
Good morning.
Good morning. Eye care. When last did I do an eye test? Yeah, I think 2 years now.
That's a long time ago.
2 years. Yes. How? And before then, I don't even think I can remember before then. I've always prided myself in having good eyesight. You know, I've never really had issues with it and all of that. But you see, am I not being too, how do I put it now? Am I not being too relaxed? Am I not being too, for people who think like me, who say, oh, everything is okay. My eyes are good. I don't need to check my eyes regularly. Isn't that being, relaxed too,
Like the topic, from cradle to grave. Before you had the last eye exam, you said you had 2 years ago. Have you ever had an eye exam?
I don't think I can remember if I have.
So technically, you don't even know what good eyesight is. You just assume you have good eyesight.
As compared to other people.
That's it. Most people just assume because they've never had their eyes checked. They just think what I see is what every other person sees. But you don't know what I see. You don't know how good I see. And I don't know how good you see, except you put yourself to the test.
Okay.
Within the normal parameters, checking the right things at the right distance, and then you know, yes, if you have good eyesight or not. That's why we'll talk cradle to grave.
Okay.
Do you know that a baby should have their first eye test before they leave the clinic at birth?
Oh.
Most pediatricians do it. They might not tell you, but most pediatricians have the kids' eyes checked before the baby is taken home. Simple tests.
Okay.
You just look at the eyes, the anatomical setting. Is the eyes well positioned? You know, there's the light we use, ophthalmoscope.
Okay.
You shine the light to the eyes.
Reaction.
Yes, you check reaction to the light.
All right.
That is the first eye test everyone gets.
How often should one have an eye test?
First, at birth.
Okay.
Within 72 hours of birth. That's the first eye test everyone should have. And most of us do, so long as you're born in the right setting where the right professionals are. You normally have that first eye test within 72 hours before the child is allowed to go home. And then after that, 6 weeks to 8 weeks, the child is supposed to come back anyway after birth for post-check after delivery. Yes, the next eye test comes and is basically 2 tests. The lights to the eye, you check pupil reaction, you check for what we call the red reflex. Now, red reflex test is done with an instrument we'll call an ophthalmoscope. You shine it into the eyes of the child. It's got a microscope, so you see the back of the eyes.
Okay, you can see.
And then you see the reflection of your light. It should be red-colored because it's reflecting the back of the eye. Remember, the back of the eye is the retina, blood vessels, and what have you. So the reflection that should come forth.
Is that why when we snap with those older cameras, I remember growing up, you always see your eyes are red?
Yes. So it's kind of a reflection of the back of the eye. But if you check a baby and you do that and you don't get a red reflex, you get a white reflex, that is a huge problem. Yes.
I think I can remember 1 or 2 pictures where we saw white. If I think back.
You don't compare it exactly with using an ophthalmoscope. Remember, an ophthalmoscope has a microscope in the instrument.
So
it helps us to see.
It does help see. All right. Okay, so when you do this, yearly, twice a year, as an adult, how often should you?
From kids, you go into toddlers. You have other tests, cover-on-cover tests, where you check to see the reaction, the movement of the eyes. If there's a squint, what we call 4 o'clock eye, you get to see all those sort of stuff. If the eyes are not well aligned, then after that, there should be the first one that comes before school, 3 years.
Okay.
There should be a visual screening at 3 years. For everyone before school starts.
Before school starts?
Yes. Okay. And then after that, annually.
After that, annually?
It should be annually.
Whew.
But most people do not. I can tell you, if you speak to most adults in fact, the younger ones are even better. If you're looking at, say, from 30 years and above, and you tell them, have you ever had oh, no, I don't have issues with my eyes. Like I asked, they don't know what normal is. A child who's never had an eye test believes I can see, right? But when you put the child to the test, you realize the child can see. And there are things you should look out for to know really as a parent.
As a parent.
Yes, how close does the child stay to the TV? How do they hold their book? Hand-eye coordination. can you throw a ball to the baby and the baby can actually, not a baby, catch really, or you move light for a child, you move a baby, you move, they follow it, or you put a toy, they follow it. You check the eye muscles also, 8 quadrants.
Okay, there's this belief, I don't know whether I'll call it a myth or something, that soaking Gary affects the eye. I just said I had to put it there and ask.
Everybody tends to ask.
Does that? Is that really?
I don't think so.
Is that valid?
I don't think so. If it does, I would have. Because I went to a boarding school.
I said, I went to a boarding school.
So that was life.
The amount of Gary I've soaked.
That was sustenance.
Some people will not soak it in their life.
Well, that was sustenance in school then. But I think everything to the excess has issues. But I don't think you say Gary actually. Gary is carbohydrate.
All right. Now, when you take this, before or while you take this eye test and all that, are there things that we can do to improve our eyesight on our own?
I think the most important thing really is to have an eye check first.
It's,
I don't know, it's life. Eye check is life. Do you understand that the eyes there's nothing but the eyes?
Yeah, true.
You can have a kidney transplant. You can even have a heart transplant, but not with the eyes. Yes, thank God the world is, there's now the bionic eye coming out with the new AI and all of that. But then even at that, how many of it is available? How many of us can afford it? So let's start with doing the simplest of things. They say prevention is better than cure. Check the eyes first. After the yearly thing, as we get older, once we're 40, there are things that come after 40. The need for reading glasses. And then for some persons, due to hereditary, there could be other conditions that could come up in the eye. But if you don't have the annual eye examination, then you will miss those things. And you could have someone, as they get older, they lose sight. There could be age-related macular degenerations. Remember that as we age, we degenerate, whether we like it or not. But everyone wants to live out their life with their eyes in place. But if you don't do the right test, find out what the problem is on time, begin to take care of it on time. That's when you see some persons probably lose sight before they live life. And then they become a burden to themselves.
To the rest of people around them.
Yes, and it's not a good state of mind for anybody to be in.
So, just to put this one out there, talking about costs to do an eye test, we'll be encouraging people. It's not something that's expensive, right?
It's primary health center. Government has primary health center. It's free.
It's free off, you see.
You see, most people just put cost ahead. First, seek help. Primary, have a routine, regular read. Let's see you read the charts. It is free. It's when you now begin to go deeper and deeper into when there is a need. It's not everyone that has the need. You could go for the test and you're fine. And after it, you're wished, have a good day. We'll see you next year. And you go home, you have done the right thing.
The right thing.
At least, God willing, for 12 months, except there's a trauma, God forbid, or something, you're sure that you can get through another 12 months. It's free at the primary health center. So why not go to a primary health center? But then there are so many private places available as well where the services are affordable.
Affordable, yeah.
We know affordable is a relative term, but it's affordable.
It is. I understand what you mean. So we just have to round up now, but what you're saying and what I like about what you just said is that, look, it's not about trying to do things to make your eye better. Go for the test first. That is the most important.
It's important. And then when you know what it is, then you can now improve on it. Now begin to say, okay, this is my state. How do I make it better?
How do I make it okay? So see, we're not telling you to go and try anything. Go for a test.
Yes.
That's the most important thing. Thank you so much, doctor. That's a word I will take back.
Thank you.
Today. It's a pleasure.